In this video, we are demonstrating ultrasound-guided Quadratus Lumborum Dextrose injection combined with fenestration of the thoracolumbar fascia for the management of chronic myofascial low back pain. The patient is positioned prone and a low-frequency curvilinear ultrasound probe is placed in the paramedian position of the lumbar spine, oriented along the long axis of the Quadratus Lumborum and iliocostalis muscles. On sonographic imaging, the QL muscle is identified between the middle and anterior layers of the thoracolumbar fascia. Before proceeding to the injection, let's first see the anatomy and how to scan and get QL muscle in long axis.
This is the iliocostalis muscle, and this is your longissimus muscle. So if I'm removing the longissimus, below the longissimus, this is your multifidus muscle. And now we can see these structures. So here, when I'm holding the probe in between the two transverse fosses, what I'll see? I'll see this is the lateral intertransverse muscle, intertransverse lateralis muscle. So intertransverse lateralis muscle, intertransverse ligament, they form the ITC. ITC full form is intertransverse tissue complex. Intertransverse tissue complex. So now, that means in between the two transverse forces, I'll be seeing the ITC. And if I'm sliding the probe slightly laterally, I'll be seeing the what? This is your glistening structure is your middle layer of thoracolumbar fascia. And anterior to that is your QL muscle. So this is your QL muscle. And if anterior to the transverse forces, this muscle is your psoas muscle.
Now we will scan and see in a volunteer.
The trident view here. Now I'm coming laterally. Can you see the QL and anterior and middle layer and the fascia nicely? Here in this patient volunteer, QL is basically well formed. And this is your anterior layer of thoracolumbar fascia. This is your middle layer of thoracolumbar fascia. This is your posterior layer of thoracolumbar fascia. So this is your erector spinae. Erector spinae means at this position it is your iliocostalis. This is QL, and this part was peritoneum. This part was psoas.
After proper skin asepsis and local anesthetic infiltration of the skin and subcutaneous tissue, a needle is advanced under real-time ultrasound guidance. Multiple controlled fenestrations are performed within the thickened thoracolumbar fascia to mechanically disrupt fibrotic adhesions and stimulate healing. Following fenestration, 5% dextrose solution is injected both within the quadratus lumborum muscle and in the fascial plane above the muscle. Dextrose in myofascial pain, the complete mechanism is still not fully understood. It likely modulates neurogenic inflammation by reducing peripheral nociceptor sensitization, including effects on TRPV1 and substance P, producing early analgesia. In addition, when combined with needling and hydrodissection, it mechanically disrupts adhesions and improves fascial glide, contributing to sustained pain relief.